Our feet take a lot of punishment. Whether it's long walks, extreme workouts, or even wearing high heels, we often don't realize how many hours we're on our feet. And that can be a problem. Like many of you, I'm on my feet much of the time, and recently I felt a pain in my foot. And I thought, well, it'll go away, but it didn't. So I knew it was time to see the doctor. It was a shooting pain between my toes. I was diagnosed with a fairly common problem, a neuroma.
A neuroma is a pinching of a nerve, where the nerve gets pinched between two of the bones that are in the foot. It can occur in different areas of the foot, but typically in between the third and fourth toes. And the nerve gets irritated in there, it gets enlarged because of the constant irritation, whether it be from shoes, whether it be from increase in activity, too fast of an increase in activity, or someone's foot height just being in that situation where it gets irritated.
A nerve can become pinched in a one-time situation, like wearing a pair of shoes that are too tight or from a trauma to the foot. Or it can happen slowly over time from repeated use or stress, which can aggravate and inflame the nerve.
It's more common in women just because women's shoes tend to be a little bit more snug up across the front part of the foot, but anyone can get it.
People tend to notice neuromas more in the fall when they start wearing closed-toed shoes. The symptoms are usually shooting pain with burning or numbness. And as the nerve gets more irritated, it swells more, causing even more pain. So how do you treat a neuroma? First, modify the shoes you wear, making sure there's plenty of room for the toes to spread out. If more attention is needed,
sometimes we'll use a steroid injection to kind of calm down just inflammation in general in that area.
Well, we first tried the steroid injections to see if we could reduce the inflammation in my foot, but that didn't work. So now we're on to something else.
We're kind of at the point of most of the conservative things haven't worked. So at that point we go to injections like an alcohol injection, which can truly destroy the nerve without having to do surgery.
A numbing spray goes on first, and then the alcohol injection goes in the top of the foot directly into the nerve. It's a small pinch and a little burn. Are we done?
We are. We're done. You did great.
Not too bad. Usually a series of 3 to 7 injections will destroy the nerve and stop the pain. If that doesn't work, the last option is surgery to remove the nerve completely. And if you don't treat the neuroma, doctors say it typically won't cause any long-term damage to the foot, but there could be unintended consequences.
If you don't have it treated, it can continue to cause pain, which can then cause you to favor it or walk differently. And a lot of times those things that happen from compensating, whether it be you walk and are walking with a limp and all of a sudden your hips hurting, your knees hurting or something like that, those can be the things that cause the bigger problems for people.
So when in doubt, see your doctor. Holly Furfer, CNN, Atlanta.